Okay. Thank you, Chairman and Co-Chairman. Today I would like to present the research named Intramedullary Distal Femoral Cutting Guide, which angle will represent the mechanical axis in total knee arthroplasty, a randomized control trial. From the many studies found that the total knee arthroplasty have a survivorship over 10 years, more than 90%, that they have many factors that determine the survivorship. The primary factor is the position of the prosthesis, is a component alignment that should not be outlier more than 3 degrees. And then we normally use intramedullary femoral guide to determine anatomical axis as the reference for performing total knee arthroplasty. And the angle of the cut was measured directly from the long film X-ray standing position that we call scanogram or computer-assisted surgery. But in the real life, many hospitals have only short film. The background and rationale, there have many research show that the routine practice of selecting cut 5 to 6 degrees at the distal femoral cut for the uncomplicated total knee arthroplasty is safe, but is performed in Europe. For the Asia, they found that 32% of the Asian patients present with distal femoral valgus resection angle that is outside the range of 5 degrees plus minus 2 degrees. Then we'll have to decide that which angle of distal femoral valgus cut is the safest for inlier prosthesis alignment for Thai people. The objective to study to compare the femoral component alignment after distal femoral cut by intramedullary guides in variant valgus angle at 4, 5, 6 degrees in total knee arthroplasty. For the material and method, we enrolled the patient about 126 with both the primary osteoarthritis that perform TKA at Sira Hospital and exclude rheumatoid arthritis, Charcot joint or pros knee and hip surgery, and then divide into 3 groups by block randomization that all of the cases perform TKA by single orthopedic surgeon and usually distal femoral side cut technique and use the Zimmer next gen design. Then we follow up at 3 months for CT scanogram, but unfortunately we lost the patient for about 1 or 2 per group, only 1 or 2 per group, and then analyze. From the alignment measurement, we measure femoral component alignment, total alignment, femoral bowing, and femoral neck sharp angle, which we get an interclass correlation at 0.87 and interclass correlation with 0.74. For the femoral bowing assessment, the method was described by Mulaji et al. That describe what excessive femoral bowing is more than 5 degrees. The statistical analysis, we compare between 3 groups, which use ANOVA for quantity parameter and chi-square for quality parameter, with p-value less than 0.05 with 95% confidence interval. For the demographic data show or this look like the same in 3 groups with no statistical significance. From my results, they show that there are no statistical significance in all 3 groups of the outlier results, and the one factor that involved is only statistical significant is femoral bowing more than 3 degrees and 5 degrees. My discussion from the study of my study show that 4 to 6 distal femoral valgus resection angle has no statistical significance in produce outlier in 2 or 3 degrees, but use of the fixed distal valgus angle does not hold true in the Asian population as shown in the literature from Europe. because of 17% of all patients are in outlier group and significantly correlate with excessive femoral bowing. Distal femoral valgus resection have high variability, especially in the elderly female Asian patient who has excessive femoral bowing. As in my study, the prevalence of excessive femoral bowing is about 21%. For in my future study, to study about excessive femoral bowing, we should fix valgus ankle cut or variable valgus cut depend on preoperative scanogram. For my limitation, I have only two limitations. Is the femoral side cut. We only use distal femoral side cut. Maybe you can not apply to standard cut of distal femur, and only one prosthesis design is next gen. Conclusion: for fixed distal femoral valgus cut in 4 to 6 degrees can be used to get postoperative component alignment, but should be aware in especially Asian people that had femoral bowing more than 3 degrees. Thank you for your attention.